Hi, my name is Rosemary Gutierrez and I'm here to perform the skills video of inserting and discontinuing the IV. So I am in my proper attire, I've removed jewelry, I have no nail polish, and I'm going to begin by introducing my client. I have a 75-year-old woman who is in the unit for IV fluids because she came in for dehydration. So I need to get an IV started on her. So performing hand hygiene, okay, applying my gloves, making sure that I have all my supplies, which is going to be my IV start kit, my 22 gauge needle, my 10 ml normal saline flush, and my lower lock extension tubing. Some of my supplies have been used due to practices, so if it's open, it's because of that reason. So normally though, in the real world, I would be using brand new products, but in this case, I've been practicing with them and I'm down to my last few. I will be using this slit here as my sharps container. And let's begin. Okay, so first I do want to prep my stuff. So I have my tourniquet, I have the alcohol swab, making sure that I do have a sterile gauze pad here, a sterile dressing here, okay? So I'm going to make sure to confirm with my patient that I've introduced with them, that they know what I'm here to do, and then of course ask them for their name and date of birth just to confirm that this is the correct patient. So getting this pre-prepped. Before I apply the tourniquet, I'm going to make sure to prep my extension tubing to remove any air. Dispose. Okay, releasing the clamp. Pushing the saline through, maybe a couple drops on the outside, and setting to the side. Okay, now I'm ready. So I'm going to apply the tourniquet about 4 to 6 inches above the intended venipuncture site. And applying the tourniquet tight, but not too tight. I still need to be able to feel the distal pulse, which I will test for before moving forward. Okay, we're about 4 inches below, feeling for the distal pulse, and I feel it. So now I'm ready to perform the venipuncture. With a brand new alcohol pad, dispose. I will clean from the inside out in a circular motion. Allow a couple seconds for it to dry. Meanwhile, removing the cap, making sure that the bevel is up, and it is. So using my non-dominant thumb, I'm going to pull back, placing my thumb about 1 inch or 2 below the puncture site. I'm going to anchor the vein, go at about a 30-degree angle, and perform the venipuncture till I see blood flashback, and I see the blood flashback. So now I'm going to advance the needle about 1/4 inch in. Okay, now we're at 1/4 inch in. Using my dominant hand, I'm going to push with my index finger until the hub of the device is at the venipuncture site, stabilizing the venous access device with my non-dominant index finger. I'm going to now press the stylet's safety button to retract the needle, placing it in my sharps container, releasing the tourniquet, and quickly attaching my lower lock device. Okay, now that that's attached, I'm going to stabilize the hub, making sure that this clamp is released and it is ready to go. So now I'm going to test for patency by pulling back and I have blood return, so I'm in the vein now. Now pushing the normal saline to flush. Slowly. Okay, perfect. Before removing, I need to make sure to clamp my extension tubing. Okay, now that I'm clamped, I'm going to remove the flush, put it into dispose, get my my dressing to remove the backing. Okay, dispose. So when I apply this dressing, I need to be careful to not cover the extension tubing, but place it right above the hub. Okay, now it's secured. Removing the rest of the backing. Dispose, saving the portion where I will be writing my initials, the date, and the time of insertion. Dispose and placing it right there. Now I will make sure to stabilize this extra tubing with an extra piece of tape on the side. Oops. Okay. Okay. And then of course, now I will connect to the IV fluids that has already been primed and prepped. And I have completed the venipuncture. Okay, the IV star, excuse me. So now I need to make sure to dispose of all my supplies that I will no longer be using. Garbage, of course. I'm going to save these gauze pads and tape for when I remove. Okay, so now I'm going to remove my gloves, dispose of that, perform hand hygiene, and leave. So now my patient is ready to go home. She's received all of her fluids and she needs to have her IV discontinued. So now I'm going to perform the discontinuation of the IV. So hand hygiene, knock on the door. Hi, patient, Miss Vasquez, it's time for you to go home, so I need to remove your IV. Okay, my hands are clean. I'm applying my gloves. I have my supplies, which is a gauze pad and tape. Okay. First, I'm going to make sure to remove the tape from here. My device is clamped and disconnected from the primed IV tubing. Okay, dispose in the garbage. Okay, this part is free now. I will make sure to stabilize the hub while removing the tegaderm, the dressing. Okay, dispose in the garbage. Okay, now with my first gauze pad, I'm going to gently place over the IV without pushing down just yet. And as soon as I pull out and release, I will apply the pressure for about 30 seconds to make sure that there's no bleeding. Okay, so I'm going to pull out the catheter. Now apply pressure, ensuring that I have a complete catheter, IV catheter, and it's complete. It's about 1 inch right now. Dispose into the sharps container, holding for about 30 seconds, making sure that there's no bleeding. Okay, it's been about 30 seconds and there's no bleeding. I'm going to replace it with a clean gauze and tape. tape. Okay. Okay, now I'm done removing the IV. I'm going to take my gloves out, dispose, perform hand hygiene, and leave the room. And that's it. Thank you.